Hi everyone, welcome back to third video of this week lecture. So in this video, we are going to discuss more on the monitoring therapy as well as the possible side effects occur when the treatment being initiated. Here are the list of laboratory assessments for schizophrenia patients should be conducted prior initiating the treatment. So he need to measure his body weight and height in the baseline level, the hematology and blood chemistry level, fasting blood glucose, FBG, HbA1c as well as the lipid profile, the EEG, electroencephalography, the brain imaging CT scan or MRI, as well as prolactin level to avoid any hyperprolactinemia in this patient. So American Psychotic Association or APA recommend that patients or schizophrenia patients who are well tolerated or symptoms have been improved with the current antipsychotic medication should remain to continue the medications. So if the patients experience any hyperprolactinemia incidents, you might want to suggest to the doctor to reduce the dose of the current antipsychotic medications or change to another atypical antipsychotic which has less prolactin effects. Aside from that, you might want to suggest to the doctor to prescribe dopamine agonists such as bromocriptine to reduce the incidence of hyperprolactinemia. Why clozapine cannot be used as a first-line agent? Because we want to reserve it as a last resort of the treatment. So clozapine can be only given to patients with treatment resistance of any schizophrenia incidents. So the patient already been prescribed with a lot of the atypical antipsychotic, but do not show any successful or progressive in the treatment. So if this drug also can be reserved as a last choice if the patient has risk for suicide attempts. Another good thing about the patients who are not adhere with the medications, current treatment available in the long-acting injectable antipsychotic drugs such as risperidone and aripiprazole. So these formulations can be given to patients who request such treatment, especially to those who are poor or not adhere to the medications. AKATHISIA is one of the most common antipsychotic side effects that cause extreme restlessness and inability to stay still. It can vary from mild to severe and cause a lot of distress. You can see in this video, this patient is restless, which will cause his feeling inner tension and discomfort, and urge to constantly move the legs and part of the body, such as arm and trunks, like just someone who restless and they cannot suppress this kind of movement. Another way that it can look as needing to shifting the weight from one foot to another or pace. So why this happen? Most of the antipsychotic drug cause drop of dopamine level and excessive cholinergic neurons activation in certain areas in the brain, especially in the nigrostriatal pathway that are involved in the controlling of the movement. Any antipsychotic drug can do this, but one that has less weight gain, less sedation, can do more, such as aripiprazole, brexpiprazole, ziprasidone, and lurosidone. The sedating medication like quetiapine and olanzapine do not do it as much as this drug because these medications, quetiapine and olanzapine, has antihistamine properties that offset these problems. These situations also can be happen to any antidepressant medications because of the feedback mechanism of increased serotonin and causing decrease in the dopamine level in the brain region, or known as hypodopaminergic. If this situation happens, you might want to suggest to doctor to lowering the dosage of the antipsychotic medications or switching to another antipsychotic medication that has less akathisia side effects, or adding a benzodiazepine medication, or adding a beta adrenergic blocking agent. As mentioned earlier, any of the antipsychotic drugs can cause akathisia, but the one that have less weight gain, less sedation, such as aripiprazole, can cause more. So the sedating medication like clozapine, quetiapine, and olanzapine do not do it as much as the other drugs because of this drug has antihistamine properties, as you can see in this diagram, that offset these problems.
Tardive dyskinesia is a condition that affects the nervous system and results in symptoms such as uncontrollable movements of the tongue, jaw, or lips, writhing, twisting, dancing movements of fingers or toes, rocking, jerking, flexing, or thrusting of trunk or hips. Why this happens exactly is largely unknown, but many believe that it's caused by a disturbance of chemicals in the brain when medications to control psychiatric symptoms are taken. Let's start by talking about how the nervous system works. Your nervous system is made up of billions of neurons. These neurons are activated through stimulation from your environment. Stimulation can be internal, such as blood pressure, or external, such as light or sound. When activated, neurons send an electrical signal down to the nerve endings and release internal chemicals called neurotransmitters. There are many different types of neurotransmitters, and each support critical biological functions such as heart rate, memory, movement, pain, and mood. For example, dopamine is a neurotransmitter that plays a role in motor control, hormone production, and behavior regulation. When neurotransmitters are released, they bind to the corresponding cell receptors and signals are relayed to the body. Depending on genetics and environment, some people have too much, irregular, or not enough neurotransmitters to bind to the receptors, causing irregular signaling. This may explain the symptoms of schizophrenia, bipolar disorder, and depression. Antipsychotic medications are often prescribed for treating mental health conditions such as bipolar disorder, schizophrenia, and in some cases depression. Many of these medications block dopamine receptors from being stimulated by dopamine and are called DRBAs. When DRBAs block dopamine receptors, additional dopamine receptors are made available by the body that are more sensitive to dopamine. When dopamine binds to these hypersensitive dopamine receptors, increased signaling can occur. This can then impact motor areas of the brain, which can cause involuntary repetitive movements called tardive dyskinesia, or TD. Certain treatments which prevent too much dopamine signaling may be required to manage TD symptoms. Tardive dyskinesia is a complicated condition that continues to be studied in order to find ways to improve or prevent symptoms that may occur. We hope this video helps you to understand a popular theory on how medications may impact neurotransmitters, which may lead to symptoms of tardive dyskinesia. Please always consult your healthcare provider on all healthcare decisions.
So another most common side effects are tardive dyskinesia. Let's watch this video first.
It makes it more difficult because I have to talk to people and be around people all day. So, the people I'm around a lot, I just let them know because I'm sure people think I'm just being silly or making ugly faces at them. Usually whenever I'm talking to people for a long time and we're looking at each other like we are, they'll be like, why are you making that ugly face? Stop that is what most people say. Stop making faces. But unfortunately, I can't stop making faces.
So as mentioned earlier in my lecture, most of the first generation of antipsychotic can cause high risk of tardive dyskinesia as compared to the second generation. It is because the action of the first generation antipsychotic that solely inhibit the dopamine receptors cause formation and increase the numbers of the dopamine receptors that cause tardive dyskinesia. In contrast, atypical or second generation of antipsychotic has rapid dissociation of D2 antagonism, which lead to dopamine binding afterward, and the serotonin antagonism activity by the drug can cause some of the dopamine neurotransmitter can bind to their respective receptor in the nigrostriatal pathway, which can minimize the formation of new dopamine receptors. APA guideline suggests to prescribe newly approved FDA class of drugs, which is reversible inhibitor vesicular monoamine transporter tools such as deutetrabenazine and valbenazine to the patient who developed tardive dyskinesia. This drug, also called as dopamine D plus through the VMAT2 receptors, or we call it only localized in the dorsal striatal at the presynaptic neurons. So this VMAT2 package the monoamine in the cytosol into the vesicle for the release into the synapse. So this drug will inhibit the VMAT2, which is a VMAT inhibitor, which will decrease the amount of monoamine that is packaged, thereby decreasing the amount of monoamine such as dopamine that released into the synaptic cleft. So this drug can prevent this tardive dyskinesia. Okay everyone, let's have a break before we continue to the next video. So in the next video, we'll recover in this case scenario as well as the Malaysia latest clinical practice guideline on major depressive disorders. So please have a look on this case before you click on the next video.